Viewers sekawan,
Today we will explore and understand
about the clinical presentation,
imaging modalities
radiographic characteristic.
of the medulloblastoma.
Let's go!
So first we will start with pathophysiology of the medulloblastoma. So what is medulloblastoma? So medulloblastoma is a cancerous brain tumor that occurs in the lower part of the brain, which is cerebellum. So as you can see, this is the lower part of the brain, which is cerebellum, and the medulloblastoma appear here. So medulloblastoma can happen at any age, but more often occur in young children. The causes of medulloblastoma. So based on the article that I have read, so the exact cause of the medulloblastoma is not known, but there is risk factor that affect the causes of the medulloblastoma. So the first is genetic mutation. So what is genetic mutation? So genetic mutation is a cancer that cancer is caused by certain change to the genes that control the way cell function. So this mutation or change of the gene will lead to increased uncontrolled cell growth in the cerebellum, and then spread the cancer cell. Thus, it will causes medulloblastoma. And then the next factor is radiation exposure. It is not common, but as you can see, children that develop another cancer while they're born, they will undergo certain radiation therapy, such as they are doing CT or X-ray to evaluate the cancer. So the radiation therapy will raise the incidence of subsequent tumor, which is it can be developed as medulloblastoma. Next, I will explain sign and symptom of the medulloblastoma. So I have listed a few signs and symptoms of the medulloblastoma. So there is headache, change in vision, difficulty walking, nausea and vomiting, and tiredness. So the first is headache. So headache often occur in the morning and while lying down. It is because pressure more increase in that position. And then next, change in vision. So change in vision such as blurred vision, double vision, and difficulty to move eye. So it is because tumor pressure it push the area in the vision at brain and area that control the eye movement in the brain. And then next, difficulty walking. So as you know, cerebellum it control coordination, balance, and movement. So since there is tumor or cancer or abnormal cell in this cerebellum, they will cause people person who having it difficulty walking, such as it will unsteadiness walking or frequently fall, and then nausea and vomiting. So nausea, the pressure in the brain that affect area that control nausea will causes nausea, and vomiting will release, but this symptom may continually occur. And then tiredness. So people that having medulloblastoma, they will feel more frequent tired. And then medulloblastoma, since it is cancer cell, it also can be spread into the organ and the spinal. So medulloblastoma, which is cancer cell that spread into the other organ, it will cause cough, chest pain, breathlessness, swollen lymph nodes, and bone pain. Meanwhile, this medulloblastoma that spread into the spinal may cause limb weakness or numbness, and bowel or bladder changes, and also spinal pain.
Alright, for the main diagnostic imaging modality used in diagnosing medulloblastoma are computed tomography, CT scan, and MRI, magnetic resonance imaging. We move to the first one, CT scan. So, for the CT scan, it is commonly used in emergency cases because it is fast and also accessible. It also helps to detect hydrocephalus, calcification, and as well as any mass effects such as bleeding. And after the initial non-contrast CT, contrast enhanced CT also can perform to improve mass visibility by distinguishing between the mass and brain surrounding tissues. So in this image, it is showing the CT in axial view. However, CT has limitation in diagnosing medulloblastoma because it can provide the better details of the soft tissue. So that's why MRI is the preferred imaging modality for further assessment of the medulloblastoma, because MRI is considered as the gold standard because it can provide high resolution of the image, high resolution image of soft tissue structures, and it can show details of the mass. So gadolinium basically is the common contrast used during MRI because it can enhance the mass visibility and distinguish the mass between the surrounding tissues, and it also can highlight the mass extent, also its spread. So it gives the clinician better understanding of the mass, or we call it as medulloblastoma.
So this is axial CT image of normal brain axial and medulloblastoma. So I will explain the structure that appear in this image. So the first we can see is right eye lobe here, and then we can see right temporal lobe, and then we can see right mastoid cell, occipital bone, cerebellum. While in this right image, we can see also cerebellum here, and then right temporal lobe, sphenoid sinus, nasal septum, left optic nerve, and left mastoid cell. So in right image, we note here there is medulloblastoma in this circle. Next, I will explain radiographic image appearance of the medulloblastoma across various imaging modalities. So, in this left side, this is axial non-contrast. It showing brainstem and cerebellum is appear normal without any focal lesion. While in this right side image, this showing medulloblastoma, which is heterogeneous mass with it is solid heterogeneous mass with calcification in the midline of the posterior fossa.
Okay, next we will move on to the axial view of MRI. The axial MRI image show a cross-sectional section of the lower brain using T2 weighted image. In the normal brain, anatomical structures such as temporal muscle, internal and carotid artery, brainstem, fourth ventricle, cerebral nuclei, posterior lobe cerebellum, nasal septum, sphenoid sinus, and temporal lobe are clearly visualized. The brain in this image, the brain appears symmetrical with no evidence of masses or compression, and the fourth ventricle also are visible and unobstructed, indicating normal cerebrospinal fluid. Okay, in contrast, we can see here with the image with medulloblastoma, the axial image of the brain with medulloblastoma here show a significant abnormality. A bright mass is seen in the midline of posterior fossa. This mass comprises the fourth ventricle and surrounding cerebral structure, which lead to distorting the normal anatomy. The lesion also appear to contain cystic area, suggesting heterogeneous content. The compression may lead to obstructive hydrocephalus due to inspired CSF drainage.
Next is a comparison between normal coronal CT brain and abnormal CT brain. And on the left side, this is a normal coronal non-contrast CT brain image that show normal brain without any pathology. And the structures that you can see in the picture is parietal bone, fourth cerebri, tentorium cerebelli, cerebellum, lateral ventricles here, and also cerebrum. While on this side, this is an image of medulloblastoma. This is a coronal non-enhanced CT image that you can see the structures parietal bone, cerebrum, cerebellum, and also we have dilated lateral ventricles that indicate hydrocephalus. And also this circle, it indicates a solid expansion of heterogeneous posterior fossa mass with cysts.
Okay, so just now I'm sure you already looked into the coronal CT image. So now let us move into coronal MRI. Alright, so here we have two pictures, which is normal, and this is the picture with patient having medulloblastoma. So we move into the normal picture first. So as you see here, all this leveling, for example, this one is the right occipital horn of the lateral ventricle. This one is the tentorium cerebelli. The whole thing here is the cerebellum, where the mass will located later. Okay, so this one is the fourth cerebri. And then now we look into the pathologic image, which is medulloblastoma. So these patients, why I say it have medulloblastoma, because you can see the mass here, which is compared to the normal one, doesn't have. Alright, So you can see this one is the mass located in the mid-cerebellum with well-defined margins. So it has heterogeneous enhancements because you can see this part is the cyst and the calcification, which appear hyper-intense in this image. So it appear hyper-intense. Why? Because this image is actually an MRI T2 weighted image. So in T2 weighted image, fluid will appear hyper-intense. That's why you see the dilated lateral ventricle appear hyper-intense. And it is dilated compared to the normal one, it should be like this.
As for the sagittal CT, both of the image showing brain, but on the right side showing the normal brain without any pathology, and for the left side showing the brain with pathology, which is medulloblastoma. We move to the normal one first. So here we can see the structure including the frontal bone, lateral ventricle, we can see the midbrain, pons, medulla oblongata, we can see the cerebellum over here, and occipital bone at the posterior side of our head. And then we can see the one divide between the cerebrum and the cerebellum is the tentorium cerebelli. So we can see there is no evidence of the pathology here. And we move to the left image here, which is the sagittal non-contrast CT, showing the medulloblastoma. From the structure shown here is same with the normal one, but you can see here, the one that I circle, there is the mass, which is medulloblastoma formed in the posterior fossa. So this mass has calcification, and as it grows, it mass compress the fourth ventricle. It compress the fourth ventricle and block the normal flow of the CSF. So when the fourth ventricle is blocked, CSF will build up, causing the hydrocephalus. So that's why you can see here, the lateral ventricle is dilated. So the size is bigger compared to the normal one here, lateral ventricle.
Okay, for the last image, you will see sagittal view of MRI. The sagittal MRI image will present a side view of the brain. For example, this image is the normal sagittal T2 weighted scan, show clear visualization of the midline structure such as corpus callosum, lateral ventricle, midbrain, pons, medulla oblongata, cerebellum here, tentorium cerebelli here, and the up here we have the parietal bone. Okay, the brain structure appear well aligned with no sign of mass effect or obstruction. And ventricular size and shape are normal, indicating no elevation in intracranial pressure. However, the sagittal T2 weighted image of the medulloblastoma here reveal a large, well-defined mass located at posterior fossa region near the cerebellum and the brainstem. The lesion appear heterogeneous with both solid and cystic component. As you can see here, you can see the mass with cyst here, and it causes compression of the cerebellum and tentorium cerebelli and is associated with dilated ventricle. As you can see, the comparison between normal and medulloblastoma, the lateral ventricle here is a bit dilated than the normal. Okay, so it's suggesting obstructive hydrocephalus. This demonstrated how medulloblastoma can significantly alter the structure and function of the posterior brain.
Okay, next I will explain about radiographic appearance of computed tomography CT. CT is a powerful imaging modality that can differentiate tissue based on their density. So this is an image of CT axial that can highlight density differences. For dense structures such as bone and calcification, they will appear brighter on the image, or we call it as hyperdense. As you can see, these bright structures are bones. And then less dense structures such as air and fat, they will appear darker on the image, or we call it as hypodense. These are the structures, air and fat, that hypodense. And then most importantly, medulloblastoma here will appear hyperdense, which is it will be bright on the CT scan and can be identified clearly. And in the middle here is a calcification, so it appears bright. Next is the radiographic appearance of MRI. MRI will offer a detailed look at different tissue characteristics through various sequences. High signal intensity structures such as fat, water and fluid will appear bright on the image, while low signal intensity structures such as bone will appear dark on the image. For T1 weighted MRI, especially post-contrast, it is ideal for characterizing tumor. Before contrast, medulloblastoma are hypointense. After gadolinium contrast, they will show strong enhancement, which will aid in clearer visualization. And then for T2 weighted MRI image, as you can see, this is a MRI T2 weighted image. It is preferred for initial detection and identifying surrounding edema. On T2, medulloblastoma are hyper-intense because of surrounding edema, cystic area and cerebrospinal fluid spaces. So this contrast will help identify the med effect, forced ventricular compression and also hydrocephalus.
Alright, so we come to the conclusion for our videos. So medulloblastoma is a cancerous brain tumor that occurs at the cerebellum. So we can see, compare MRI and CT scan, actually MRI are more preferred to detect or diagnose medulloblastoma because MRI provides a superior soft tissue resolution, which it can provide a more detailed anatomical information, allow physicians to plan better for surgical and also follow-up. Other than that, MRI also can produce image in 3 plane directly just right after the scan. Compared to CT scan, it only can produce axial image, and it need to reconstruct the image in other plane after the scan. And that's all from our presentation. Thank you.